Hello, I'm Dr. Dennis Smith of Accident and Injury Chiropractic. I've been in practice 30 years as a chiropractor here in the city of Tacoma. The purpose of this talk is to introduce you to myself and to actually teach you as a new patient how to take care of yourself and how the body works. So we're going to teach you some things that many physicians don't even realize as to how your body is a self-healing organism. I want to tell you a little bit about my history. I've been in practice here in Tacoma for 30 years. I received my pre-medical degree in 1975 from Cal State University at Northridge. And I received my doctorate in chiropractic in 1982. I also received a degree in international consulting in 1987. I was also authorized in 1989 to teach a seminar to personal injury lawyers on whiplash injuries and how chiropractic helps them. And this was certified by the Washington State Trial Lawyers Association. I've also been the first professional member of the Epilepsy Board in the state of Washington. I've also spoke at 3 of the hospitals in this state on the science of chiropractic, at Allenmore Hospital, at Good Samaritan Hospital, and at Tacoma General Hospital. First thing I want to introduce you to is the spine here. I want to teach you how the body works and how your chiropractor is going to treat that in order to reduce nerve irritation. Most people think of a chiropractor as being a back doctor. Chiropractors are not back doctors. Chiropractors are concerned with the function of the nervous system. And everybody knows that the only way that you have pain is by irritation of a nerve root, whether it's from your nose to your toes. So, if we're going to be talking about the nervous system with you and why you've come into our office, I want to start by showing you the anatomy of the body. We'll try to do that very quickly. You have the brain here, and here's the skull would be sitting here, and the spinal cord goes right down the center here. And in between the vertebrae is where the spinal nerves come out. Here you can see what's called the brachial plexus, which is the nerves that will go out your shoulder and down your arm. These can lead to numbness in the hands and arm pain and that type of thing. And then in the middle we have 12 thoracic vertebrae and we have 5 lumbar vertebrae. And down in here is where the plexus goes out that goes down your legs. So you can have a pinched nerve in your lower back that'll give you leg pain. You can have pinched nerve in the lower neck or the upper back that'll give you arm pain. And so basically what your chiropractor is trying to do is to find out any interference in the nerve system that is causing you to have that pain. If there's a misalignment anywhere in the spine, then where that nerve comes out between them will be pinched, and then where that nerve goes to is where you'll have the symptom, whether it's the top or the bottom. And you can also have irritation in the wrists themselves or in the jaw, what we call TMJ, carpal tunnel syndrome. And if we have a misalignment in the spine, we chiropractors call that a subluxation. Now, it's a big fancy word. You don't have to know all about it, but understand that the purpose is if we find a misalignment in the structure, you have a 90% chance that the chiropractor is going to be able to help you with that. And that was just tested out by the federal government through the military. So basically, the body is a self-healing organism. So if you have a pain, let's say you hit your finger with a hammer, the body should heal itself. If it doesn't heal itself, that must mean that the body is not using its proper healing processes, and that's what the chiropractor is concerned with. We may be giving you a series of manipulations to put the vertebrae back into place. We may also be giving you exercises or massage therapy, or even a medical intervention as necessary. We try to keep medication use here to a minimum, but that doesn't mean that after trauma you may not need it, and we have physicians here that will help you with that. So most people want to know is, if I've got a misalignment in my spine, how does the chiropractor help us? What we do is find out where that misalignment is. We set up some series of manipulations to retrain that joint back into place. Most people think we pop it into place, but the reality is we're retraining that joint and retraining into the brain to get the body to release what's called endorphins, which is the body's painkiller. That's why if we're using the endorphins of the body as a response to the treatment, less medication is the use while your body is healing.